Started. My name is Brian Blaze. I am the president of Paragon Health Institute. Fortunate to have my colleague with me today, Elman Eric, who is really become an expert in this subject area over the past year, particularly after we did our initial report. Paragon's work on improper and fraudulent enrollment in the Affordable Care Act exchanges started in the spring of 2024. The reason that we got into this area of research is because of testimony that I gave in the state of Texas in the spring of 2024. When I was there, I was asked a question by a state senator about information that he was hearing from brokers about income manipulation in the Affordable Care Act exchanges in order to maximize the subsidies that are sent to health insurance companies and that make the plans much more affordable for enrollees. After I heard that, I went back to my team and we undertook an effort to really do a simple data analysis to quantify the extent of improper enrollment, and that led to a major report that Paragon released in June of 2024, the Great Obamacare Enrollment Fraud. After we did that paper, we got contacted by a bunch of people that were familiar with the scams. We did research, and 2 months later, we released a follow-up paper unpacking the Great Obamacare Enrollment Fraud. This spring, we updated our 2024 analysis with the 2025 numbers, and the problem worsened. So we named that paper the Greater Obamacare Enrollment Fraud. And then just over the last couple of weeks, we have done work related to the rise of Obamacare phantom enrollees. And we will get into that later in today's presentation. But that's an important aspect of the overall improper and fraudulent enrollment in the Obamacare exchanges. We are going to start with a presentation today, and we're really going to do a deep dive into why the fraud and improper enrollment has exploded in addition to quantifying it. We're then going to take questions that you have. If you do have a question that comes up during the presentation, please use the Q&A button on the Zoom feature. With that, I am going to get started. The scope of the problem. We define improper enrollments as an enrollee in the 100 to 150% FPL category who does not have that income. What is really important about this category is because of legislation signed by President Obama, or signed by President Biden, signed by President Biden, these plans were made fully subsidized. So the enrollee pays nothing for this coverage. In 2024, we estimated there were 5 million people enrolled in this category who were not eligible. That increased to 6.4 million people in 2025. So a 28% increase in improper enrollees. We estimate that the cost of improper enrollees in 2025, at least $27 billion for taxpayers. There are 15 states where there are more than twice as many enrollees in this category as are eligible. If you look at those 15 states, 9 of them adopted the ACA Medicaid expansion and 6 didn't, and that's something that we'll get into shortly. The primary reason for improper enrollment in the exchanges is because of this legislation signed by President Biden. He signed legislation that made the out-of-pocket premium for enrollees zero if they claimed income in this category. Here's a graphical description, an illustration of how these, what we refer to as the Biden COVID credits, that's our term for these enhanced ACA subsidies, how they work. The way that the original ACA subsidies were designed is to limit the amount of household income that a household would have to pay for a benchmark plan. The blue line is the original ACA subsidies. The vertical axis is the percentage of household income that household would have to pay for a benchmark plan at a given level of the federal poverty line. And you can see the lowest income enrollees had to pay 2% of their premium for a benchmark plan. The rest of the premium would be subsidized by taxpayers. The share that people would have to pay gradually increased as household income increased, and the financial assistance was capped at 4 times the federal poverty line. The Biden COVID credits shifted that blue line down to the orange line, and it made the coverage fully subsidized for individuals claiming income between 100 and 150% of the poverty line. You could see it made the subsidy more generous for other enrollees, and the cap at 4 times the poverty line was lifted. Because of the lifting of that cap, you have some enrollees that have hundreds of thousands of dollars of income. There's families that have income up to $500,000 that receive taxpayer assistance to purchase an exchange plan. The subsidy structure is complicated. Almost all of the subsidies are advanced to insurance companies that offer the plan chosen by the enrollee. So here's what happened in 2025. In the fall of 2024, a person would estimate their 2025 income. The subsidy would be determined based on that estimated income. And every month, the federal government would send an amount to the insurer that offers the plan chosen by that enrollee. In 2026, when people file their taxes for 2025, we'll know what actual 2025 income is, and there will be what's called the reconciliation period. If people got too much subsidy, which many people get too much subsidy because they estimate income, they underestimate their income, then they would be required to pay a portion of that subsidy back. However, there are significant limits on the amount that has to be repaid if the enrollee received too much advance subsidy. This chart shows the subsidy recapture limits. The most notable feature are the enrollees below 100% of the poverty line. So if an enrollee below 100% of the poverty line, if they overestimate their income and they claim more income than they actually have, and they file their tax returns and their tax returns has that low income, they don't have to repay anything. There's no subsidy recapture. So there's no penalty for misestimating income for those enrollees. And there are significant caps for other enrollees that underestimate their income. This is one of the most important figures to understand what has happened. It is the incentive to cheat. So this is the excess amount of subsidy beyond what would have to get repaid for people both below 100% of the poverty line in the non-Medicaid expansion states that overestimate their income to claim a subsidy, as well as the incentive for enrollees above 200% of the poverty line to misstate their income, to underestimate their income, and claim more subsidy than they're eligible for. So you can see there are sizable financial incentives for enrollees to misstate income. So what is the evidence of improper enrollment in the exchanges? So we have in 2022, all of these plans are now fully subsidized for people that claim between income between 100 and 150% of the poverty line. So what happened to the percentage of exchange enrollees claiming income in that narrow band? Well, it significantly increased. It went from just under 40% in 2022 to now 55% of enrollees in states using the federal exchange claim income between 100 and 150% of the poverty line. So this is just data for states that use healthcare.gov, which is the federal exchange portal, which is about 2/3 of states that use healthcare.gov. The 10 worst Obamacare fraud states. There are a few columns here that I want to walk you through. The first are these exchange signups. So this is government data from CMS. They post exchange enrollees by income grouping. So these are people that have signed up in this category where they get a fully subsidized plan. And by the way, this is a fully subsidized plan that has a 94% actuarial value. Actuarial value is the amount of typical expenses for an enrollee that a plan will cover. What this means is that this plan also has extremely low deductibles and extremely low copayments. The next column are who we estimate are the eligible enrollees in 2025. Who is not eligible in this income category? The first group are children. Children with income below 150% of the poverty line are either going to be eligible for Medicaid or the Children's Health Insurance Program. So there should be no children enrolled in this income category. Seniors. People 65 and older are not eligible for exchange subsidies, so there should be no seniors. So we looked at 19 to 64-year-olds, and we looked at people that didn't report Medicaid or Medicare coverage. So that is the eligible enrollees. The difference, the percentage of exchange enrollees over eligible enrollees, that's the next category. And then you have the raw difference, which are subtracting the two. So these are the 10 states where fraudulent enrollment is the most extreme. What's common about all of these states? They all use the federal exchange as their platform. And when Elle goes, she's going to explain what we've learned about the federal exchange. So all of this improper enrollment, really starting in mass in 2023 and 2024, has been automatically re-enrolled into the exchanges for 2025. 45% of exchange enrollees in 2025 took no action during open enrollment. They were just moved from one plan to, in many cases, the exact same plan. No updating of information, no changes on their behalf, just re-enrolled from one year to the next. Here's a really interesting set of data. So the government collects information on whether enrollees report race or ethnicity. The orange line is the number of enrollees that don't report race or ethnicity. And you could see a stunning increase, particularly from 2023 to 2024. This is when we think the zenith of the healthcare fraud here was open enrollment 2023. Huge increase in people signed up, in many cases without their knowledge, without their consent. Because of that, because of how they were enrolled, whoever enrolled them just filled out on the form unknown race or ethnicity. It's now more than half of exchange enrollees in 2025. The federal government doesn't know their race or ethnicity. Our data Importantly, we think it underestimates the scope of the problem. One primary reason is because we exclude states that have the basic health program. And those states include New York, and we know there is massive improper enrollment in New York. The Empire Center in New York has done work on this. There's several 100,000 enrollees in New York who are almost certainly improper enrollees. And from 2024 to 2025, improper exchange enrollment only declined in 2 states. One of those states, North Carolina, expanded Medicaid. And you would expect a decline in fraudulent exchange enrollment when enrollees moved from the exchanges with a subsidy into Medicaid. The other state, interestingly, is Virginia. What Virginia did during this time is switch from a federal exchange state to a state-based exchange state. And there's just been more integrity in state-based exchange states. And Elle, I am turning it over to you to unpack the Great Enrollment Fraud.
Well, thanks, Brian. This is a great moment to kind of get into what are the ramifications of a policy that is set up this way. Brian did a really great job of kind of setting it up and showing all of the different incentives that exist within the structure of not only just the original ACA, but the enhanced premium tax credits, which we are calling the buy and go credits. It is really, really important to note here before I even get into the fraud schemes, though, that even if the enhanced tax credits were to go away, there is a generous subsidy structure that remains within the ACA, and that is very important. There are lots of folks out there that are fear-mongering right now, saying that all of the subsidies are going away and that people aren't going to have access to generous subsidies, and that's just not true. And I'm going to explain why the enhanced subsidies are even more of an issue beyond just small, inexpensive healthcare coverage for those that need it. Truthfully told, the subsidy structure within the ACA breeds fraud, and the way that CMS has this set up breeds fraud as well. So think of the federal marketplace as a big app that anyone in the United States can use to enroll in ACA coverage in their state. Now, the only difference would be that if that state has what's called a state-based exchange, which essentially means that they run their own health insurance marketplace. But what happens is that there is this incentive structure based on how it's set up. So brokers or agents, which are not the same thing, and I'm going to refer to them in the meantime as intermediaries for an important reason. Brokers touch about 80% of applications that go through the individual market. Now, that being said, not all brokers are built equally. You have independent brokers that are out on their own, really helping folks navigate through the insurance market, finding the right plan for them. You have unscrupulous brokers, is who I'm going to be talking about when I'm talking about fraud. And oftentimes, these unscrupulous brokers are not even licensed insurance agents. They simply use different types of things that are built within the ACA, one of those examples being the NPN override, to join large-scale organizations that have licensed professionals that they submit all of their business through. And what makes this a great environment for fraud is brokers are legally prohibited from being able to charge for their services. So in order for them to get paid for the services that they offer, they enter into contracts with different insurance carriers. So it's very important to note here that a lot of the control and a lot of the power when it comes to who gets a contract and who is able to sell that type of plan comes from the carrier themselves. So the carrier will enter into a contract with the broker, and then the broker receives a monthly commission, including an add-on payment or bonus payment, depending on what type of enrollee that is, or if they are new or returning. So for example, if I'm a broker and I enroll someone and it is their first time being in the ACA, that carrier will give me a $50 bonus. And then for every month that that person is enrolled in that ACA plan, and as long as they are paying their premium, I will also get a monthly commission. Depending on what the carrier is, that commission varies. So as you see here, the more people that you enroll, the more commissions that you get. Now, this is not a problem for an independent broker that is trying to help people navigate through services, but this is a problem for an unscrupulous broker or a rogue agent or a large system that is simply just trying to enroll folks. And so with a 100 to 150% special enrollment period where anyone could essentially enroll at any time during the year, That allows unscrupulous brokers to completely circumvent the open enrollment process and simply try to enroll people at all times. And so what happened is slowly but surely, more and more brokers wanted to enroll more folks. And so in order to do that, they started playing really insane games. And a lot of this is simply just because of the lack of program integrity that CMS had in this process and a lack of program integrity on the federal level. For an example, if I am a health insurance broker, up until April of 2024, I could log in, access any individual that is enrolled in an ACA or individual market plan in the entire country, and have access to their social security number. If I'm a fraudulent agent, what stops me from writing down all of those social security numbers and continuing to enroll people even when it's not against their knowledge? So these are 3 examples of ads that these large unscrupulous brokerage firms and other agencies like marketing agencies, communications firms, etc., lead generating companies. That's where you can buy and sell data to try and help you with your enrollments. And these are some of these examples. What they would do is they would take the full subsidy amount and advertise that as a cash gift card or as some sort of service. So as you can see here, it says, get your $6,400 subsidy savings you can use for gas, rent, or groceries. This one over here says, hurry up. You have less than 24 hours left to get your approved government subsidy. Chat with us to see what's going on. So with the $0 plans and these other special enrollment periods, it was simply so easy to enroll folks. That's why we say it was enrollment at any cost. And that is still maintaining even after some of these program integrity provisions. There's just always going to be bad incentives for unscrupulous people to come in and take over all of those enrollments. And it got really widespread. I'm going to the next slide here. This is a great article that was done by Bloomberg, and it essentially goes into how people were using deep fakes and celebrities and all of these other crazy ads, including one that was Taylor Swift, to try and get people to enroll into the ACA plans by having like a deep fake. And they would come on and say, do you want $600 a month in a gift card? Sign up through this. And they would hit the ad and they would go. And essentially what would happen is you would click on the ad online, you would enter into your simple information, like who you are, maybe where you live, what your birthday is. But at that point, that is 75% of all of the necessary information on an insurance application in the individual market. So these unscrupulous brokers would take all of that information and then lie about incomes to enroll people even without their knowledge. I'm going to get into some of the examples and some of the quotes that are from this, but essentially they turned into get rich quick schemes. This one was about Money Matt. You can see him here celebrating Kamala Harris's birthday party at the White House, but he made over $1 million in a small year. He made $75 million with Enhanced Health, to the point where they were making so much money off of unscrupulous broker bonuses that they bought a NASCAR team. They bought a NASCAR car. That is insane. And the Bloomberg reporters completely go through it and talk about how people got up in this. And they quote one broker saying, you have to throw away a bit of your mortality. And that's because they were so focused on all of those bonus payments that they were enrolling anyone at any cost, and they knew that they were doing it threatening people's lives. And I will get into that in an additional second. This all confounds all of these different policies together, really made a perfect storm for this. Joseph Walker from the Wall Street Journal put out a really great ad, a really great article talking about the process from the minute you click on an ad to the end stage. And he talked about how the 100% 150 special enrollment period really created this year-round enrollment that led to a continuous opportunity for brokers or unscrupulous brokers to boost the subsidies or to boost the payments that they were getting and make sure that they were enrolling at any cost. There's been several like class action lawsuits about all of this, mainly because this isn't just about unscrupulous brokers getting additional bonus payments. What they were able to do was use the 100 and 150% SEP with all of these other things to go in and change an enrollee's income by a singular dollar. When they changed the income by a singular dollar, that essentially allowed them to enroll into a new plan, which introduced a new phenomenon called plan switching. Julie Appleby from KFF has really great reporting on all of this. We detail it in our Unpacking the Greater Obamacare Enrollment paper. But basically, enrollees would have their plan switched so that there would be a new agent. So it would go from the agent that enrolled you, that helped you navigate, maybe that independent broker that's doing a great job, and the unscrupulous broker would come in, steal that application from them, and now they get all of the subsidies. But in order to do that, they had to change the plan that you were on. That led to people losing their health coverage. That led to people not being able to get surgeries. That led to folks being on new plans where their prescriptions for, say, diabetes or other life-threatening conditions were no longer covered on their plan and they had to pay completely out of pocket. And this led to several lawsuits, mainly because CMS until last year really didn't take any action in stopping all of this. So enrollees and the independent brokers took it into their own hands. So this is just one example. It talks about Money Mat and Enhance Health, which I was just talking to you about. Again, this is a class action lawsuit that has not ended yet. And this is just the alleged actions of these two people and their organizations that are going on. But in 2024, the victims and their independent brokers filed a class action lawsuit against the lead generation company and a call center that was calling and pretending to these people, including their parent organizations, alleging that they purposely targeted lower income Americans with deceptive advertising, leading to both fraudulent ACA health insurance plan enrollment and unauthorized plan switching. In lawsuit, it alleges that they intentionally sought out homeless folks and folks there, offering them cash Visa gift cards if they enrolled in the health insurance. Lots of these were false ads, including the deep fakes that I was talking about, saying that you can get this as cash instead of getting it as a health insurance tax credit. Essentially, what is very clear, even if this is just alleged through all of the stories and not just this class action lawsuit, is that unscrupulous brokers or rogue actors or these rogue intermediaries are empowered by wanting to receive the additional bonus payments through these get-rich-quick schemes and use things like enhanced enrollment platforms, call centers, marketing agencies, and lead generators to make sure that we have enrollment at any cost and fraudulently enroll many folks, many of which don't even understand that they're enrolled in that health insurance. There have been 2 additional DOJ cases this year. Again, these are all alleged. There have been several indictments. One, they indicted an Obamacare brokerage president. He pleaded guilty to over $161 million in fraud committed through the ACA program. They face over 50 years in prison on wire fraud, conspiracy, and money laundering charges. There is an additional Florida brokerage. When we say that no one does health fraud quite like Florida, it is truly true. In April of 2025, there was an additional Florida brokerage whose executive pled guilty to inflating income so ineligible customers could get ACA tax credits. The DOJ said that that scheme preyed on vulnerable consumers, again, using the homeless and the unemployed and those with mental health and substance abuse issues to scheme the government of over $133 million. And unfortunately, how everything that this is structured, the only people that truly face true consequences are the enrollees that were fraudulently enrolled themselves. Whether their plan was switched and all of a sudden they're out, they can't get the surgery they want, or their prescription is out of network, or at the end of the year, they're saddled with immense tax burdens as a result of their ineligible enrollment because you have to pay back that subsidy when you don't qualify. There are hundreds of stories of people having both insurer-sponsored insurance and then being fraudulently enrolled into an ACA plan. And then at the end of the year, like an example of Ashley here, who was supposed to get over a $4,000 tax refund, ended up owing the government over $700 because she was fraudulently enrolled in an ACA plan while she had insurer-sponsored insurance. The reality here is that the insurer who is receiving a cash transfer, a monthly cash transfer for every enrollee that they have on an enhanced subsidy or even subsidized plan in general, they face zero consequence in making sure that all of that money that was fraudulent and sent directly to them every month is paid back. Now, for the brokers, there are some consequences. Now, the reality is CMS has not done a great job of making sure that they feel consequences. The insurers do not do a good job of making sure that they end contracts with fraudulent brokers or end contracts with brokers that have been proven of fraud. And so the only person in this entire scheme here that faces a consequence is the enrollee. And they are the only one that does not have a financial stake or make money from being in these plans.
Yeah, thanks, Elle. So at Paragon, we focus on the incentives within government programs and what the natural consequences are from incentives. And we try to get the incentives right so that we have a health sector that's responsive to the individual patient and where our spending produces good health outcomes. And what we see with the structure of the ACA with the Biden credits is that there are massive incentives to cheat. Enrollee, brokers have found that a lot of these people will not pay any of their own money to sign up for coverage. So there's this scheming and manipulation that goes on to make the coverage appear free for the individual. And then the insurers get massive expansion in revenue from all of these subsidies that come in from individuals that have been improperly enrolled. So we have all this improper enrollment. What is a potential consequence? A potential consequence would be you have people that don't know they're enrolled, have other types of coverage. Well, you have all these enrollees now that don't use any medical care. And we've been looking for data on this for a long time. And 3 weeks ago, CMS released data. The data that they put out from 2019 to 2024 in the ACA individual and small group markets are the number of enrollees that don't use any medical care during the year. What this chart shows is the percentage of enrollees without any claims. The orange line is the small group market. The small group market was not affected by these Biden COVID credits. The Biden COVID credits, again, start full effect in 2022 in the individual market. That's when you start to see the separation in these lines. And in 2024, 35% of Obamacare exchange enrollees didn't use their health plan a single time. So no doctor's visits, no labs, no prescriptions filled. And in comparison, typically private insured adults, only about 15% of them don't visit a doctor or a healthcare professional in a given year. So we're looking at this is about 2.5 times above what you would expect. Now, that previous chart just showed the percentage. We know there's been an overall surge in total enrollment. So from 2019 to 2021, again, no Biden COVID credits. And you have the number of individual market enrollees that have no medical claims flat. Then you see it significantly increase. Where is it most increasing? It is most increasing among individuals that have fully subsidized plans. The dark blue area are individuals that have that 94% actuarial value free plan. So you see a surge there. You also see a surge in the bronze plans. Most bronze plans enrollees also have free plans because you can take that subsidy and you apply that same subsidy to any plan. A bronze plan is less expensive, which means the taxpayer share of that premium is greater. So just a surge in the number of enrollees with no medical claims. Now, we do not say that the number of enrollees with no medical claims are phantom enrollees. In a health insurance market, you're going to have a given percentage of enrollees that don't use any medical claims, but that's like 15 to 20%. We are now double that. We're at 40% of all the enrollees in these fully subsidized 100 to 150 94% actuarial value plans, and 40% of enrollees with bronze plans that have no medical claims now. This chart shows the percentage of enrollees with no medical claims. It demonstrates that, again, the increase, the dark blue line, the 94% AV plans, that's been the biggest increase. That's what you'd expect with this fraudulent and phantom enrollment going on. And then you see an increase with the bronze plans as well. Where you don't see an increase is where people spend their own money. So that's where we don't see an increase in the percentage in the number of enrollees that don't have any medical claims. So the silver off exchange plans, that's people using their own money. There hasn't been an increase in the number of people with no medical claims there. Likewise for catastrophic people spending their own money, you actually have a decrease in the number of people with catastrophic coverage that had no medical claims. Okay, so a huge increase in phantom enrollment, huge increase in improper enrollment, driven by the Biden COVID credits. I want to give you some perspective on the situation of the taxpayer enrollee share when the Biden COVID credits expire. When the Biden COVID credits expire at the end of 2025, and again, this was a pandemic measure put in place just for a short period of time, the taxpayer will still bear the vast majority of the premium for the vast majority of the enrollees. This figure shows the taxpayer share of the premium in 2026 based on the age of the enrollee. And you can see older enrollees, the taxpayer is going to be bearing a higher share of the premium because their premiums are higher and the government limits the amount of income that they have to pay for a premium than for the youngest enrollees. The typical exchange enrollee, if you had the median exchange enrollee, they make about 150% of the federal poverty line, and they're about age 50. And you could see from this chart that individual would bear about 10% of the cost of the premium next year when the Biden COVID credits expire. So 90% of the premium would still be paid by the federal government. This puts dollar terms there for that 50-year old enrollee. And again, it shows, so the blue line is the share paid, the premium paid under the Biden COVID credit regime. The orange line is the share paid under the original ACA subsidies. You could see that delta, that is the value of the Biden COVID credits. At 400% of the poverty line, that's where the biggest difference is. So Obamacare limited subsidies to households with less than 400% of the poverty line. The Biden COVID credits, they lifted that cap. So that is the biggest marginal impact of the Biden COVID credits. Now, you don't need to take your subsidy and purchase a silver plan. You could purchase a bronze plan. Bronze plans are less expensive. They have a lower actuarial value, which means the taxpayer share of those plans, premiums, will be higher. This figure shows that even the Biden COVID credits expire in 2026, almost half of enrollees would be able to sign up for a free bronze plan in the market. And many others, you're only going to have to pay a small fraction of the cost of bronze plans premiums because the underlying Obamacare subsidies are themselves so generous. And this is the equivalent figure. And these four figures are in a policy brief that Paragon released yesterday that show the distributional analysis of the taxpayer versus the enrollee share of the premium. I have one more slide, and then we're going to get into questions. There are 10 reasons to let the COVID credits expire. Number one, they were a temporary pandemic measure. Government did a lot of extra spending during the pandemic. The pandemic is over, and we can't have sort of this permanent increase in the size of government because of the pandemic response. They are extremely expensive. They cost more than $40 billion a year. And that doesn't include the deadweight loss costs, which are the foregone economic activity from the taxpayer burden to finance the subsidies, which is another $20 billion a year. I think we have conclusively demonstrated the COVID credits have led to tens of billions of dollars of fraud and abuse annually. They reduce incentives for insurers to provide value for enrollees. If the enrollee is paying nothing for their premium, the insurer isn't competing for that enrollee's business. They don't have to offer a plan that enrollee values. And that is a real problem as the quality of ACA plans continues to be low and diminished. Number five, the figures that I just showed, the taxpayer already bears the vast majority of the costs for most enrollees. Number six, they lead employers not to offer coverage. If employers offer coverage, their workers don't qualify for an ACA subsidy. If the ACA subsidies are more generous, that diminishes employers' incentives to offer coverage. Nonpartisan experts expect anywhere between 2 and 4 million fewer people with employer-based coverage if the Biden COVID credits are extended. Seven, they're inflationary. They give insurers pricing power that results in higher healthcare prices. So if the entire premium increase is borne by the taxpayer, that gives insurers extra pricing power and reduces their incentives to drive good deals for those enrollees. Number eight, these subsidies go directly to health insurers, and many of the excess subsidies cannot be recovered. Number nine, if government just continues to subsidize this program, it's going to delay or prevent needed reforms to a program that is badly in need of fixing. And finally, extending the Biden COVID credits would expand federal subsidization of abortion. With that, we are transitioning to questions. And I want to say one thing before we transition to questions. And this, we'd strongly recommend, Al mentioned the Bloomberg article. The Bloomberg article is exceptional. One of the authors has won a Pulitzer Prize, but we strongly recommend you go and read the Bloomberg story about how the schemes work. We are not saying anyone specific has committed fraud, but it is important to understand that there are very well thought out schemes that have exploited the incentives of the ACA with the Biden COVID credits put in place that leads to really significant damage to enrollees who are enrolled and switched without their consent, as well as wasted taxpayer dollars. Okay, Elle. I'm going to take one of the initial questions that we got and give it to you. And again, please, we have about 15 minutes left in our presentation. Please go to the Q&A button if you do have questions. LU, and we've highlighted that the fraud is concentrated in states using healthcare.gov. Can you explain why there is so much more fraud in the federal exchange compared to states that have state-based exchanges?
Sorry, sure. The simple answer on that is that Biden policies really eroded the federal marketplace, and a state-based exchange really served as a buffer from that. So in a state-based exchange, you are simply just allowed to have more control of how policies are administered and which ones you bring into your state-based exchange. So for an example, we talked about how Virginia was one of the only states that actually had fraud to go down between when we did our analyses. And that's because in 2024, there was actually the first year that Virginia was a state-based exchange. So from 2023 to 2024, Virginia no longer allowed the 100 to 150% SCP. And they were able to do that because of the fact that they had the state-based exchange. A lot of states, including blue states, will go up against some of these policies and not permit them. Many blue states and states that have a state-based exchange require you to have pre-enrollment income verification. That's something that you did not have to have on the federal level. So the easiest way is to say that, one, it is very easy to scheme the federal marketplace. I think part of that is because it's so one size fits all that there's bugs. Similar to like when you would give an app an update. There's a lot of bugs that come with it across the board. And then additionally, when you use the federal marketplace, there is an incentive for carriers or marketing agencies and lead generation agencies to utilize something called an enhanced direct enrollment entity. It's called EDE. Basically, it's like a website that makes it a little bit easier for you to enroll. There's an example of one called Healthsperian that actually CMS last year prohibited from being able to be an enhanced direct enrollment entity on the federal marketplace because they were sending all of their data overseas and using that to launch call centers to fraudulently enroll folks. That's on the CMS website. You can find that there. So like I said, long story short, EDEs and all of these other things with the federal marketplace make it a lot worse and make the environment much more ripe for fraud. And when a state has a state-based exchange, they're allowed to have a lot more program integrity and flexibility and what policies they implement.
Thanks, El. So one of the things, we talked a lot about brokers. CMS did take actions in the last year of the Biden administration around brokers. My argument has been that they waited way too long in the process. They had evidence, and then this became an issue as there were news outlets. As Paragon Research started highlighting the extent of the problem, CMS felt forced to act, and they did take some actions with respect to brokers. Can you talk about the actions that they took with respect to brokers and why they really had very little, if any, effect?
Sure, absolutely. So first of all, CMS did try to go in and suspend a large amount of brokers. Unfortunately, they were found to have violated statute and tried to do too much, and so they had to walk all of that back. But if you look at the amount of brokers that have been suspended versus the amount of brokers that are actually terminated, you'll find that those numbers are shockingly very, very low. One thing I really want to point out here is that there is no sort of two-factor authentication on the enrollee side. So if I were to like log into the federal marketplace as a broker and make a change to your application, there's nothing that gets sent to the enrollee that really like lets them know that happened. And so I always like to say, if I have two-factor authentication using my Taco Bell app to order my lunch, we should absolutely have two-factor authentication when it comes to anything involving my insurance. But CMS implemented what they called a three-way call policy. So now in order to switch someone's plan or enroll them within an SEP, etc., the broker, the enrollee, have to get on the same phone line and call CMS. The problem with that is simply if unscrupulous brokers and intermediaries already had incentives before to commit identity theft, what stops them from using that call center that they purchased with all of the money they made from all of these different bonus payments in the unscrupulous broker goes and using that to pretend to be the enrollee on the phone? And the answer is that that did occur. So unscrupulous brokers were absolutely able to game that three-way call system and simply call and pretend to be enrollees. And so that made it very, very hard for CMS to even be able to stay on top of this issue.
All right, so I'm going to take two. One is on CBO. So CBO, actually just this week, in response to some House committee chairman, issued an analysis around Obamacare, And for I believe the first time, they estimate, or they put out that they also believe that there are millions of improper enrollees in the ACA exchanges. So it is not just Paragon. You have Paragon, you have the Congressional Budget Office saying there are millions of people enrolled in this category that aren't eligible in this category. And you've got all of these news stories that have come out documenting these schemes. So we what we are saying is happening is not a small scale fraud activity. It is a nationwide, massive amount of fraud and improper enrollment that has been perpetuated because of bad government policy and that harms the legitimate enrollees, um, and harms taxpayers that are funding all of this money, much of it, going captured by health insurers, but also to bad actors that have just taken advantage of the fact that the government has set up a bunch of policies that have enabled waste, fraud, and abuse to flourish. CBO does estimate that if the enhanced subsidies aren't extended, there would be a reduction of about 4 million enrollees in the market. Now, I put that 4 million enrollees and compare it to the fact that we estimate there are 6.5 million enrollees who are not eligible for the program. Really, what we're saying is the law should be enforced appropriately, and that these expanded subsidies have led to such waste, fraud, and abuse that they should not continue. Now, some have said, and we got asked about a court decision from last week, but some have said that because of the Trump administration regulation, that really it was a solid regulation to undo a lot of Biden era policy that led to so much of this fraud and waste, that put policies in place to address some of the problems around like re-enrollment, automatic re-enrollment, and that people could just self-attest to their income without actual verification of what people put on their applications. Um, and there are some provisions in the One Big Beautiful Bill that address this as well. But administrative actions are always subject to uncertainty. One, that a future administration could reverse it, but also that a court could intervene. And that's what happened last week, where a court came in and struck down several provisions of this program integrity rule. I think that makes it even more imperative. Like phantom enrollees, this is not old news and a problem that has been fixed. This is a problem that almost certainly will increase from 2024 to 2025 and will remain a serious problem unless the underlying policy gets fixed. And a key part of the underlying policy getting fixed is for these expanded subsidies to expire after 2025. Elle, I'm going to see if you've been monitoring the chat and you have some questions that you would like to respond to.
Yeah, sure. There was a question earlier today that really underscores what we were talking about with the generosity of their underlying ACA credits that are or ACA subsidies that are within current law. There was a question talking about how, there's potential for there to be $0 bronze and $0 gold plans, even if the enhanced subsidies went away. And does that mean that those can be gained by the broker? The simple answer on that is not as easily. But it is really important that we continue to find ways to hold the insurance carriers and these fraudulent intermediaries responsible, and holding them responsible for the fact that they are signing up ineligible folks. And the way of doing that is really coming up with ways to make sure that they have skin in the game when it comes to having someone that a fraudulent enrollee, making sure that they're not just going to receive a direct cash transfer from the government for someone that is either doesn't exist, doesn't know they're enrolled, has another plan, or could have their health negatively impacted by that. So there is a need for additional additional guardrails. That is something that was not addressed within the program integrity rule. That's something that has not been addressed by OBBB. And that shows that there's even more need that until you can address the incentives for both the insurance companies and the unscrupulous intermediaries that they hire to help make them profits, there is going to continue to be ways that there's fraud. There has been fraud in the ACA system since 2010. CMS and insurance companies didn't do anything about it because it did not start to impact enrollees until the introduction of the widespread 94% actuarial plans. Now, that is going to continue. Fraudsters find ways to keep innovating, and so it is our job to end this relationship between an unscrupulous intermediary and that being a good thing for a carrier.
Thanks, Al. So just sort of rapid fire, a few questions. Got a question about the 90% cut in navigator funding and any effect on that. I think that'll have very small, minimal effect. The navigators weren't really effective in enrolling individuals. And we got some questions about the public view of expanding the subsidies. We asked about this in the poll that we commissioned earlier this year related to the One Big Beautiful Bill and reforms in the One Big Beautiful Bill. And when the issue was described accurately, and you could find the wording for the exact question that we asked and the background information, we found that actually there were more Americans who support letting the subsidies expire after 2025 than continuing them. I think fundamentally, the health sector needs a lot of reform. The ACA program needs a lot of reform. We have put out policies on how to reform the ACA. So I'll just mention sort of a one big bundle. It would be an appropriation of the cost sharing reduction program. The cost sharing reduction program appropriation was in the House passed version of the reconciliation bill. It would address something called silver loading, which I don't have time to get into. But the short story is it would lower premiums, particularly for people without subsidies, and it would lower federal spending, CBO projected by $30 billion over a decade. We also think we need to reorient the subsidies away from insurance companies to individuals. We are going to subsidize healthcare for vulnerable and low-income Americans. How can we best do that? We're not going to best do that by just funneling it through the middlemen. We should give the patients the money under their control, and we put out a policy solution in a paper we did several years ago called the HSA option, which would take a portion of the subsidy and give it to the individual under their control. Finally, the administration and Congress could just work on expanding affordable coverage options. So there's options for small businesses through association health plans where small businesses can join together and offer coverage that is more affordable. Individual coverage HRAs, where businesses offer a contribution that workers take to buy in the market. And then something called short-term health plans, which are much more affordable, much more flexible, were opened up by the Trump administration. Unfortunately, the Biden administration reduce their availability. The Trump administration could, undo that rule and open up that type of coverage. But we should be focusing on expanding options and really removing all of these government policies that so distort the market and lead to higher healthcare prices and higher spending over time. We are out of time, so I am going to close. There is a link up here to follow us on social media. I'm going to stop sharing. I now realize that has been up on the screen for a very long amount of time. So hopefully, I wish I didn't leave it up quite that long, but hopefully you followed us on social media. And I encourage you to go to paragoninstitute.org to check out all of our research and policy analysis. There's a lot on the Affordable Care Act, as well as other areas, really all areas of health policy. Thanks so much for joining us today. A copy of this presentation and the recording will be on Paragon's website as soon as possible. Have a great rest of your day. Bye.